The National Centre acknowledges country and the traditional owners of the lands on which we live and work, and we pay respects to elders past and present. And we recognise and accept that sovereignty has never been ceded. We also want to honour the lived and living expertise of all victims and survivors of child sexual abuse, harnessing all ages, cultures, abilities and backgrounds, and commit to substantially addressing harm of child sexual abuse now and well into the future. We also want to recognise that there are children and young people today who are experiencing sexual abuse and dedicate ourselves to doing all we can to promote their effective protection and care. I just want to underline and recognise this great crowd of people today, coming today, and on the panel and in our agencies who are all sharing the same agenda, which is to support victim survivors and to prevent child sexual abuse in future. Recognising the personal challenges inherent in having conversations about child sexual abuse and trauma and mental ill health and not being heard and having access to care, I would very much like to encourage you to take care of yourself as you listen and to reach out for support if needed. We've provided phone numbers to access. Please take care of yourself and you throughout this conversation and afterwards. I would now like to introduce Ben Mathews. He's the lead investigator who's going to speak with us about key findings from the Australian Child Maltreatment Study. He's a professor of law and a principal research fellow at the School of Law at Queensland University of Technology in Brisbane, Australia. He's the adjunct professor at Johns Hopkins University, Bloomberg School of Public Health in the US. He's internationally recognised for his research expertise in the field of child sexual abuse, and he was a professorial fellow to the Royal Commission into Institutional Responses to Child Sexual Abuse. We're absolutely delighted to have Ben with us today, and I'd like to hand over to you, Ben, to talk through your data and your findings and your recommendations. Thank you.
Thank you, Leanne, and thank you to the whole board of the National Centre. I really appreciate the chance to engage with you and everyone in the audience today. Thank you very much. I'd like to also acknowledge the traditional owners of all the lands on which we meet today. I'm coming to you from the lands of the Turrbal and Yagara people on which QUT now stands, and I pay respect to their elders past, present and emerging. Thank you again, everyone. The first thing I'd like to say is that I'm talking today about the Australian Child Maltreatment Study, which was a very large and comprehensive study about the prevalence of all 5 types of child maltreatment and their associated outcomes through life. But today, for our audience today and for the National Centre and its purposes, I'm focusing on the findings about child sexual abuse. I can tell you that this has been a huge study with a large and stellar team, of which I'm just one small part, but it's been a real privilege to be part of this study. There's obviously a mountain of data that we've generated, and I've got maximum of 15 minutes to share some of the key findings with you today, so that's what I'll do. But I can assure you that the full findings, or the main findings from our study, have been published in a special edition of the Medical Journal of Australia just 2.5 weeks ago on the 3rd of April. And we also had a major public launch event the day after that on the 4th of April. All of our main findings and ACMS resources are accessible freely on our dedicated website that's on that slide there. That includes all of our scientific articles for those interested in them. But we've also produced infographics and a public report in lay language that is hopefully accessible to everyone, every member of the public. So please feel free to avail yourself of those resources. And just to let you know, we're continuing to conduct further analysis of our data set, including in relation to child sexual abuse. So there will be more outcomes forthcoming later this year and next year and the year after. With that, I will get to the study itself. I'll just first give a bit of background about its nature, and apologies for anyone who's heard this before, but I'll just give a bit of background about what we did in this survey and how we did it before getting to some of the key findings. And at various points, I'm just going to thank Anna for advancing the slides. Thank you, Anna. So what the Australian Child Maltreatment Study has done is to generate a national evidence base, not only to generate scientific data, which is sorely needed, but with a key purpose to inform better policy and practice. Our studies had two major aims, and that's to generate evidence that Australia has not had before about child maltreatment, including sexual abuse. But the second aim is to take that evidence and put it in the hands of policymakers and legislators and practitioners so that we can all better understand, prevent, identify, and respond to child maltreatment in future, including sexual abuse. So what this study has done is to conduct the first comprehensive national study of the prevalence of each form of child maltreatment. That is, what percentage of children experience sexual abuse, physical abuse, emotional abuse, neglect, and exposure to domestic violence. We've also identified the characteristics of those experiences. So, for example, when children experience sexual abuse, how old are they typically when it begins? And who is it who inflicts that sexual abuse? Because obviously we need the prevalence data, we need the percentage of the population who experience child sexual abuse to do a better job of preventing it in future. But we need further information about its nature so that we can develop really precise public health targeted prevention efforts. The third thing we did in the study was to identify the associated mental health outcomes of these experiences in childhood. And we've generated some really chilling findings about this. So we've looked at mental health and health risk behaviours like self-harm and suicide. And these findings are really important for us, both scientifically, but also for policymakers too. And finally, we're identifying the burden of disease to the nation from maltreatment as well. Thanks, Anna. So the way in which we did this study was to do a nationwide survey of 8,500 people aged 16 and over. Within that sample, and it was a random sample, and that's a really important part of the study because it gives you very, very robust, rigorous, unbiased data. Within the 8,500 people, we had 3,500 people who were aged 16 to 24. So adolescents or young adults aged 16 to 24. That gives us really strong information about experiences of child sexual abuse in relatively recent times in Australian history. So we've got a good understanding of what's happening right now. We also had 5,000 adults aged 25 plus, and these were comprised of 1,000 adults in each of 5 age decade strata. So we had 1,000 people aged between 25 and 34, 1,000 aged 35 to 44, and so on, right through to age 65 plus. And that was important for two reasons. First, it enabled us to measure trends in child sexual abuse at different times in Australian history. So we can see from our data set, is sexual abuse more common now, less common, or is it about the same? Or are there different patterns in different types of child sexual abuse now compared with in former times? Also, the advantage of having these 5,000 older Australians as survey participants is that we can track the associated outcomes of child sexual abuse, not just in adolescence and early adulthood, but right through the lifespan. So a very, very powerful, large sample and data set that we've generated here. Thanks, Anna. What was really important in this study, and to take it beyond the level of previous work done both in Australia and elsewhere, was to make sure that what we measured actually was sexual abuse and that we weren't missing things that were sexual abuse. Equally, we needed to make sure we weren't measuring or counting things that on the best definitions may not constitute sexual abuse. But really, it's the first part of that equation that's really, really important. So some studies overseas have measured the prevalence of child sexual abuse, but they've used definitions that aren't quite congruent with what child sexual abuse actually is. And I'll just give you a quick example of that. Many studies have measured the prevalence of sexual abuse, but they've limited the concept of sexual abuse to acts done by people 5 years older or more than the child who was abused. And that misses a large proportion of child sexual abuse done by people around the same age, and particularly adolescent to adolescent or peer-to-peer sexual abuse. So one really important part of this study, and this took the first 2 years of our 5-year project, was to very, very carefully define what sexual abuse is and to craft our survey instrument and the particular survey questions about sexual abuse in such a way that the findings about prevalence of sexual abuse were absolutely watertight. And I'm happy to say that we have done that. So we took a lot of care and a lot of time to do that. So we very, very carefully measured all maltreatment types. Thanks, Armin. And there's a lot more information about that in our published papers. To give you just a very, very quick summary of how we define sexual abuse, we drew on the best literature worldwide from the social science and the health literature about what child sexual abuse is. And as a conceptual model, child sexual abuse is best defined as including both contact and non-contact sexual acts by any adult or child in a position of any kind of power over the victim. That could be physical, could be societal, it could be economic, could be psychological. Third, it must be to obtain sexual gratification, but that need not be immediate. It could be deferred in time or space. And finally, when the child, that is the child victim, either does not have any capacity to provide consent, for example, a very young child, or they may have technical capacity to provide consent to sex, for example, a 16-year-old, but they did not actually provide consent in the particular circumstances. So that was the conceptual model we used. And if we go to the next slide now, we'll see the actual survey questions we asked. So I'll just draw your attention to a couple of things on this slide, which is quite important. We asked 7 different questions to all, we asked 7 different questions in our survey. 4 of these questions went towards calculating our prevalence estimate and then all of our calculations about the associated outcomes of child sexual abuse. And those 4 questions are bolded in the middle of the slide there. So if we look at the one in the blue shaded little graphic there, the looking at private parts, that was the one question about non-contact sexual abuse that we included in our prevalence estimate. So there we asked, did anyone ever look at your private parts when they shouldn't have, or make you look at their private parts? And that question was introduced with a further explanation about what types of things we were meaning. We had 3 other questions about contact forms of child sexual abuse. So the touching of private parts, attempted forced sex that wasn't actually completed, and forced sex that was actually completed. And when we talked about forced sex, we made it clear we were talking about oral, vaginal, or anal intercourse or penetration by any body part or object. So those 4 bolded questions are what we call the 4 core child sexual abuse questions that we counted in our prevalence estimate. Now, just so you know, we asked 3 other questions. One was about generalized sexual harassment that we asked of everyone. At the left of the slide here, we can see that we asked 2 other questions just to the participants aged 16 to 24. And these were about online sexual victimization. I won't be talking about this today, and we haven't published this data yet, but there are some pretty chilling findings about these types of sexual victimisation. So here we asked these young Australians about non-consensual sharing of sexual images by anyone, and we also asked about online sexual grooming by adults. Thanks, Alan. Whenever anyone answered yes to one of the 4 core questions we asked, we then asked some follow-up questions. And this is really important, again, because it gives us that nuanced information about the nature of the sexual abuse experience. So we asked, how old were you the first time this happened and the last time it happened? We asked, who were all the people who did this to you? For sexual abuse, we also asked questions about whether they'd ever told anyone about it, how old they were if they had, who they'd told and if they felt supported. And we also asked how many times did this particular act happen. So a very, very rich picture was developed about child sexual abuse. Thanks, Anne. We then had separate sections of our survey that obtained extremely valuable information about the associated outcomes of child sexual abuse. We did this for all the other maltreatment types too. So we measured mental health outcomes, and a very, very strong aspect of the study was that we actually administered a clinically diagnostic instrument. So we didn't just ask people, have you ever been to a doctor for mental health reasons, or have you got any mental health symptoms? We actually administered a diagnostic instrument. And we obtained information about whether the participant had ever in their life had major depressive disorder, or whether currently they met the criteria for generalized anxiety disorder, post-traumatic stress disorder, or alcohol use disorder. Thanks, Anna. In the section after that, we asked about health risk behaviours, and these were also really important outcomes that we assessed. So we asked about smoking, subclinical alcohol use, so binge drinking, cannabis dependence, self-harm, and suicide attempts. Thank you, Anne. Okay, so that's the background, and here we are with the results. So I'll take you through some of the results for the whole sample, and also some of the results just for the youth sample age 16 to 24. And here's one of the headline results. So we found that from our whole sample of 8,500 Australians, again, a random sample that was representative of the population, 28.5% of Australians had experienced child sexual abuse at some time in their life up to age 18. So 1 in 4, slightly more than 1 in 4, had experienced child sexual abuse. Now, in that bar graph, we're depicting the rates that we found for each of the 4 specific questions. And then in the 2 bars at the left, we're comparing contact and non-contact. So I'm going to start right at the right of this bar graph. So 8.7% actually had experienced forced sex. That is rape in childhood. 13.8% experienced attempted rape. 18.9% sexually abusive touching, and 18.1% experienced the non-contact form. And some people experienced multiple types, obviously. The bar at the left there indicates that 23.7% experienced 1 or more of the 3 contact sexual abuse questions. Okay, so we've got some really chilling statistics here. And at this point, it's really important to remember that while we're talking about statistics, numbers, percentages, all of this represents the experience of individual Australian people while they were children. And this is happening. It's happened in the past. It's happening now. And it will continue happening in future. And it's really important to bear witness to the individual experience of each of these individuals and to do our best to prevent this in future. Thanks, Anne. If you could just go to the next slide now. When we did an analysis of sexual abuse by sex, we found that there's double the rate of sexual abuse for females compared to males. So we can see in the bars at the third and fourth bar here, we have 37% prevalence of sexual abuse among Australian females and 18.8% in males. So twice the rate in females. Now that is a major disparity. It is an enduring and consistent disparity that's happened over time in Australian society, but it is absolutely not acceptable. And we need to do everything we can to turn this around and reduce that sex disparity. That is absolutely not acceptable. We will see in a moment that this disparity is not getting better in current times. I don't want to downplay the experience of males or of boys in childhood. We absolutely should not do that. The fact that 18.8% of males in Australia have experienced child sexual abuse is itself a national tragedy. Nevertheless, we do have double the rate for females, and that absolutely cannot and must not be ignored. Thanks, Anne. This slide now shows the prevalence rate just among our youth sample aged 16 to 24. Okay, now these data are included or were included in the slide we showed before with the whole sample, but the value of showing this just by itself is that it presents the results of the 3,500 participants, so a very large data set in and of itself, to show what the situation is or has been in recent years in Australia. And as you can see, 25.7% of our 16 to 24-year-olds had experienced child sexual abuse before age 18. So that, again, is a shocking figure. 1 in 4. This is Australia. Okay, Australia, the so-called lucky country. Again, we see some very similar figures. If we look at the bar at the right of that bar graph, that figure for forced sex, 8.7% among this youth sample, is identical to the rate of forced sex, i.e. rape, in our whole sample. That is a really chilling statistic. 1 in 12 Australian kids are experiencing rape in childhood. Really, really, really serious. We can, however, see that when we compare the 25.7% figure for the youth sample with the 28.5% for the sample overall, we do see a slight decline. And that's a slight but significant decline, both statistically and contextually. It means that there is a decline in some domains of sexual abuse, and that's a great thing. And I'm just going to take you to a couple of slides about this now. Thanks, Anne. I'll first just point out that when we look at the youth sample age 16 to 24 and compare the prevalence of sexual abuse for females and males, we can see that this disparity has actually widened in recent years. So before, for the whole sample, we saw that comparison of 37% and 18.8%, so pretty much double. Now we can see amongst youth age 16 to 24, the sexual abuse rate is 35% for females and 14.5% for males. It's 2.5 times the difference. So we actually have seen one of the areas where sexual abuse has declined slightly in recent years is in boys. So there's fewer boys experiencing sexual abuse now and slightly fewer girls experiencing sexual abuse, but not as much as for boys. So that disparity has actually grown. And that's a matter of significant concern. There is clearly so much more we need to do to prevent sexual abuse, and especially of girls. And I'll come back to that shortly. Thank you, Anna. One of the really interesting parts of our data set, and it's a very rich and comprehensive data set, which enables us to do a lot of really rich granular analysis, is to identify who is it who's inflicting child sexual abuse. And here I've presented some rough data that we haven't yet published in peer-reviewed papers, but we are have that article well advanced. But we're showing some broad figures about different classes of offender when we look at our whole sample and the prevalence rate of 28.5% who have experienced sexual abuse. So this is showing a breakdown by class of offender. So when we asked who were all the people who did this to you, we actually had 42 different codes of offender that here we've collapsed into 6 classes of offender. And what this is showing is some quite striking and disturbing trends. The first thing I'll point out is that 7.8% of our entire sample had experienced child sexual abuse either by a parent or by an adult parent-like caregiver in the home. That could be an adult male relative, it could be a grandparent, it could be a foster carer. 7.8%. Now, both myself and many of our team members have been in this field for a long time. That, for us even, is a really chilling and heartbreaking statistic, 7.8%. We can also see in the cell below that 2% of our entire sample had experienced sexual abuse within an institutional setting, such as a school or a church or a sports club, by an adult caregiver in that institution, 2%. Now, that's obviously less than the rate by parents or adult caregivers, but when we consider that and extrapolate across the entire population, that is a lot of children being sexually abused by these people who are meant to be caring for them. That's a disturbing finding. We see in the middle there, 7.5% sexually abused by other known adults, 4.9% by adults they did not know. And at the top right of this slide, a very important figure that we found, 12.9% were sexually abused by another adolescent aged under 18 who they knew. Now, we have another slide coming up shortly about that gives a bit more information about that. But here, this is a really important finding that directs us to an area where we can and must devote much more attention to prevention. Thanks, Anne. I'm just going to whip through the next few slides, just conscious of time. But what I want to emphasize from this slide is that change is possible, and there are some good news stories from our analysis. We're just talking about the overall 7.8% rate of sexual abuse by parents or adult parent-like caregivers in the home. But when we look at that rate for that group of offenders, we can see that in recent years, that rate has declined substantially. So while we have, somewhere between 8 and 9% over 4 decades, in recent times it's reduced to 7.3% in the 25 to 34-year age group. And amongst our 16 to 24-year-olds, it's 4.4%. Now, the first thing to note there is that 4.4% of children in Australia being sexually abused by a parent or parent-like caregiver in the home is way too high. That's 1 in 25 kids. That's 1 kid in every typical classroom of 30 kids or so. Way too high. That is tragic. However, the silver lining from this analysis is that prevalence of that class of offending has substantially declined, and it's likely that that's the product of a number of different factors. That should encourage us to maintain all those efforts and continue those. We want that trend line to continue going down in future as far as possible. So that's some good news to hold on to and be inspired by, but we do need to be cautious because sexual abuse by other types of offender have actually increased. Thanks, Anne. This slide captures that particular trend. So what this is showing is that sexual abuse by other adolescents, and especially by current romantic partners, typically boyfriends, or by former romantic partners, typically former boyfriends, has increased. And essentially what this slide is showing is that within our youth sample, there are 5.7% of our whole youth sample that has experienced sexual abuse by another adolescent aged under 18 who was a current romantic partner or a former romantic partner. And when we look at that 5.7% and break it down by sex, 9% of females aged 16 to 24 reported being sexually abused before age 18 by another adolescent aged under 18 who was a current or former romantic partner. So in other words, in current or former dating relationships, there's an awful lot of sexual abuse happening in a nutshell, and most of it is affecting females, and most of it is done by males. This is a priority, as far as I'm concerned, for future prevention. Now, we have seen in recent times through extraordinary efforts, hugely accelerated consent education, which is a fantastic thing. We need to continue that. We need to develop it and accelerate it. But we also need broader preventative sex and relationships education, especially for boys. Thanks, Anne. Just a couple of slides on the outcomes of sexual abuse. I'll just start here with a broad finding. This is about all maltreatment, not just sexual abuse. So we found that mental health disorders are far more common amongst anyone who has experienced maltreatment. Now, this is obviously not to say that anyone who experiences child maltreatment will have a mental health disorder, because they actually don't. But what we found when we compared people who have experienced maltreatment is that almost half of all people who experience child maltreatment met the criteria for one or more of the 4 mental disorders we measured, so 48%, compared with 21.6% of those who did not experience child maltreatment who had one of those mental disorders. So a very, very strong 2.5% times likelihood of having one of those 4 disorders. Thanks, Anne. Now, when we conducted further analysis about the independent effects of different types of child maltreatment on having those mental health disorders, we generated some really important findings. This is not to downplay other types of maltreatment, but nevertheless, it highlights for us, for the scientific field, but also for policymakers and practitioners, where our prevention efforts need to really be accelerated and why. So we looked at the odds ratios of experiencing different types of child maltreatment and these mental health outcomes. And we took into account in really sophisticated statistical modeling the experience of other types of maltreatment and other types of confounding factors, socioeconomic status, etc. So these findings are really strong and robust. And what we found is that 2 of the 5 maltreatment types consistently had by far the strongest associations with mental health disorders. And they were sexual abuse and emotional abuse. And this slide here is showing the odds ratios for sexual abuse and PTSD, anxiety, severe alcohol use, and depression. And they're close to double for all 4. Emotional abuse is similar for 3 of them. And that's another key finding, but we won't go into that today. But what the take-home message from this slide is that sexual abuse is very strongly associated with these very severe, debilitating mental health disorders. Thanks, Anne. When we looked at health risk behaviours by experience of any maltreatment, we found some striking findings. In particular, we found that cannabis dependence, self-harm in the prior year, and suicide attempt in the prior year were very, very strongly associated with the experience of any of the maltreatment types we measured. So this is a global slide. It includes sexual abuse and other types. And we found, for example, that if you experienced any maltreatment, you had 6.2 times the odds of being dependent on cannabis, 3.9 times the odds of self-harm in the prior year, and 4.6 times the odds of suicide attempt in the prior year. Now, if we look at the next slide, we'll look at a breakdown of the odds ratios by key maltreatment types, and a similar pattern to the previous slide on mental health. So again, we found that of the 5 types of maltreatment, sexual abuse and emotional abuse again had the strongest associations with multiple health risk behaviours. And here the contribution of sexual abuse was particularly strong, especially for self-harm, suicide attempt, and cannabis dependence. So these are powerful findings that really inform very strong arguments for turbocharging our prevention and treatment efforts in relation to child sexual abuse. Thanks, Anne. This is actually the last slide I'll show you today, and this is actually taken from the public oration that we gave when we launched the study 2 weeks ago. Now, this slide is actually about recommendations in relation to our findings about child maltreatment as a whole, so not just sexual abuse, but all of these levels, all of these recommendations actually do apply to sexual abuse. And there's a couple that I would choose to expand upon in relation to prevention of sexual abuse, and that discussion might happen later on in the panel discussion. I'll draw your attention just to a couple of points before stopping. One thing we need to do as a nation is coordinate our approach at the national level. So one of the problems we've had is that we just haven't been working together enough across levels of government and across portfolios and across sectors to really put our minds to doing a comprehensive, careful and properly resourced job to prevent child sexual abuse, identify it and respond to it. The second thing is we need to invest much more and much better, and we need to have a public health approach and a major emphasis on prevention of this before it happens in the first place. At the societal level, we need new social norms against sexual violence and against gendered violence. This is absolutely key. At the community level, we need to support practitioners who are capable of responding to child sexual abuse. At the individual level, we need to support parents, but we need a lot more than that. We need a lot of education, especially starting in early childhood. And I can say a lot more about that in future. We need, especially that point number 6 is particularly directed towards emotional abuse prevention and response. So I won't dwell on that today. But the 7th point is about sexual abuse prevention. And here in a nutshell, we're calling for a sexual, but also a relational evolution. It's absolutely essential to talk about increasing and enhancing sexual abuse prevention, consent education, etc. But sexual abuse is about sex, but it's about more than that as well. We need to talk about and develop and improve how we relate to each other in romantic relationships, but also in non-romantic relationships as well. So we're really supporting turbocharged prevention and educational efforts there and so much more. At that point, I think I've used up my allotment of time, but thank you very much. I hope that was informative. Very happy to share these slides. And again, all of our resources are accessible on the website. And thank you very much. Happy to answer any questions that may have come up.
Thank you so much. There's been quite a lot of questions about the detail in the data, and we hopefully will get to some of those. I just really wanted to start by asking you and also thanking you for both the work and the presentation. How did you include the views and voices of young people and adult victim survivors in the child sexual abuse component of the study?
Thanks, Leanne. Great question. And one thing we did in the first 2 years of the study was to have a very careful and comprehensive approach to development of our survey instrument and the testing of that instrument and the refinement of it. And we had 5 or 6 stages in there. And some of the most important stages were, in fact, to consult with people with lived experience of child sexual abuse, to ask them their opinions, to ask them for their feedback, and to actually test the instrument, the questions with them, to see what they thought about the questions, to see if they caused substantial distress, to see if they had other feedback for us. So we did that expressly with people with lived experience of sexual abuse, and we're incredibly grateful to them for that. In terms of young people generally, we did that again with youth participants as well to get their views and feedback. We also had a separate stage of cognitive testing that we conducted in Melbourne in 2 rounds of cognitive testing. And we specifically targeted in those rounds of testing a certain subsection of people who were youth so that we could have that direct voice and feedback.
Thank you. All right. Well, look, I think what I'll do is we're getting lots of great questions. We obviously have a very smart group of people listening today and asking, targeted questions about the data and some of the issues within the data. I'm going to move to a broader panel discussion and weave those things in as we go. For people who are new to the National Centre has been the brainchild and the vision of 3 founding members, the Australian Childhood Foundation, Blue Knot, and the Healing Foundation. And each of those CEOs are on the board, so I have the great privilege of working to them and with them, but also are going to speak today about some of the issues that they can see and perhaps where, as a National Centre, we might take these things. So I'm going to start with Dr. Joe Tucci, who is the Chief Executive Officer of the Australian Childhood Foundation. He's a social worker and a psychologist, and he's completed a PhD in emotional abuse and uses postmodern and narrative ideas in research, counselling and training. He has a particular interest in the impact of abuse-related trauma on brain development and the implications for practice. Joe has an extensive experience in the provision of consultancy, clinical supervision, program development and evaluation, and he is the chair of the National Centre for Action on Child Sexual Abuse. So Joe, going to you, what stands out to you most about what the data that Ben's presented is telling us about child sexual abuse in Australia?
Thanks, Leanne. Thank you. And I told you not to do a long introduction and you still did, so that was way too long for me. Hello, everybody. Thank you, Ben. It was an incredible presentation. Every time I hear the data, it makes me think of another point. Let me start acknowledging the traditional owners of the land that I'm on, the Wurundjeri people of the Kulin Nation, and pay my respects to their elders past and present. And also note that as a National Centre, we're going to do whatever we can to support the constitutional reform around the voice to Parliament. So that's important to us and important to I'm sure many people on the webinar today. I'm interested. I've heard you speak a few times, Ben, and I'm really interested in translating the percentages into numbers. And I've been trying to do that myself, and it's probably unhelpful for a social worker to be given a set of numbers. But it's quite staggering, really, when even if you do some just general calculations. My assessment is you talked about 28.5% of the whole sample had experienced child sexual abuse by the time they were 18, and there's about 20.5 million adults in Australia at the moment, roughly, as far as I can tell. So if you take that across, it's about 5.8 million people that are living in Australia, adults living in Australia today, who have experienced child sexual abuse in their life, which is an incredible number. I don't think when you just say 28.5% or 1 in every 4 really gets you the kind of the experience of what that means, the implications of what that means to the community of having so many victims and survivors of child sexual abuse in particular coming into contact with health services and coming into contact with housing services and coming into contact with aged care, with the police and in the justice services or alcohol and drug systems. If there was ever a reason and a rationale for the country to become more trauma-informed, for these systems to centralise their knowledge of trauma and know how to respond to that first, it's now. If we don't do it now, I'm not sure when we'll be able to be convinced that we need to do that. And it's an interesting kind of concept. I'm sure Cathy and Fee will talk about it as well in a minute, but some of the very models that we have in these service systems, like the medical model or an addiction model for drug and alcohol problems, almost need to be rewritten on the basis of how much the population of people that would be going into those services, then that their needs are based in the trauma that they've experienced during childhood. So it's an incredible kind of opportunity that we have, which is, I think, what you're saying, Ben. It's an incredible opportunity for us to really reshape the way that we offer services and think about the treatment of victims and survivors, let alone start to think about prevention and what it will mean. So that's my first kind of comment, I think. And I won't take up all of the time, Leanne. So that's my first comment. I'll leave it up to you.
Thank you. I'll come to Cathy in a sec, but Ben, did you want to respond to that?
Sure. Look, I totally agree, Jo. And you used the term opportunity. To me, and I actually used this phrase in the public launch event. I said it's an opportunity for us, but it's also an obligation for us. And I was directing that term obligation specifically to governments at Australian government level and state and territory government, because they have the primary obligation to protect citizens, and especially to protect our most vulnerable citizens, of which children are some of the most vulnerable. So this for me is a non-negotiable duty of government. I totally agree with you that there is a massive opportunity, though, for practitioners and professions to improve the way in which they are equipped and prepared to deal in a trauma-informed way with their clientele who may have experienced child sexual abuse. And I think there are things that we can do there and things we probably need to do there. It is, there are perennial challenges, and these challenges are heightened today in our workforces. So everyone knows the health sector, the educational sector, social welfare sector is dramatically understaffed, under-resourced and under strain. And that presents real problems to which we are all extremely sympathetic. But if we can do things like enhance pre-service and in-service education and support for practitioners, then that is something we should definitely do. And if we can use really agile ways of doing that, that are easily delivered, say through online means, then that might enable us to make some good gains.
Thank you, Ben. And actually, I think Cathy will be able to respond very much in that sense. Let me introduce Cathy Kezelman, who's a medical practitioner president of Blue Knot Foundation, and has a lived experience of complex trauma. She's been a driving force within Blue Knot, previously ASCA, for over 2 decades, and has held a number of key board and representative roles within the mental health and related sectors. Cathy is a co-author of a range of seminal Blue Knot publications and guidelines. She's a prominent voice in the media and at conferences, and a national advocate for trauma-informed transformational changes and informed responsiveness to people experiencing the impacts of complex trauma. She is the Deputy Chair of the Board of the National Centre for Action on Child Sexual Abuse. And Cathy, what stands out to you most about the data that we've heard today?
Thanks, Leanne, and I agree with Joe, that was too long, but you know, a big thank you to Ben for, you know, just such a considered, comprehensive, pivotal benchmarking set of data, and to your fellow researchers. Before I begin, I'd just like to acknowledge the lands I'm on as well, the lands of the Gadigal people, and pay my respects to elders past, present and emerging, and acknowledge people with a lived experience of child sexual abuse. And having had that experience myself, I just obviously have a very personal investment in this. And I think what this data has done has really confirmed, built on and validated what many of us living with this experience and working in this field have known for a long time. But I think what it needs to do much more broadly is paint the picture, which it has, that, you know, child sexual abuse is really an isolated incident. It often occurs over time. It occurs during developmental periods. It impacts attachment and relational engagement, and that it has so many flow-on effects over time. And I think there's a real lack of understanding about that, about the not just the prevalence and data, as you say, every number is a person whose life has been upended. And as a society, as a developed society, we pride ourselves on being, you know, highly civilized and highly advanced. And yet the issue of child sexual abuse and child maltreatment has been largely ignored. It's very discomforting, but it's no more discomforting than for the people who've experienced it and for the people who live with it every day. And I think, you know, to build on what Joe has said, this incredible research, and it's going to continue and be built on it. And I know, you know, there's a lot more to come out of, you know, the initial data set, must make government stand up and take notice, because child sexual abuse and child maltreatment underpins so many of our societal challenges, of our health challenges, and yet it's not been seen in its own right as a fundamental issue to be addressed. And what this data has also shown is that it often doesn't occur in isolation, that it's probably by definition impossible to be sexually abused without being emotionally abused. And what was interesting, Ben, in what you raised was that emotional abuse has not really been considered such a significant form of abuse, which is an interesting judgment. But yet the fact that they often occur in tandem, and obviously the high prevalence of family and domestic violence, shows that this is a picture. This is not, you know, an isolated, neat example of a single incident, which, again, not to minimise a single incident at all, but these are patterns of behaviour over time. And we need to understand the profound impact they have on people's lives. And what your data has shown us is it's delineated that, it's spelt it out. It's shown in terms of the health risk behaviours, in terms of physical health issues, which are often not understood, and obviously in terms of mental health issues. And so if this isn't a public health crisis, then what is? And so I suppose my core question is, what is it going to take for us to respond to this crisis, what else do we need to know to, not all be proactively trying to prevent, protect, intervene early, and intervene right through the life cycle, because we need to do something about this now. So thank you, Ben, and your fellow researchers for giving us the tools to influence policy and practice.
Ben, did you want to respond?
Just to say thanks, Cathy. I appreciate your comments very much. Just a quick remark. One of the things I think we can do independently of government, perhaps, is within sectors and professions and occupational groups, perhaps, is to ramp up that practitioner preparation. I think that is something we can do. However, at the higher level, if we're really to make major gains in preventing sexual abuse before it happens, we need that Australian government involvement and coordination between them and states and territories. And I'll just mention that we have, before we did the public launch, we had 30 high-level in-confidence briefings, most of which were with Australian government agencies, right up to the Department of Prime Minister and Cabinet. And so we were urging certain things. I think one of the challenges is, and one of the reasons why we have not, as a nation, tackled child sexual abuse or maltreatment in the past anywhere near well enough, is there isn't a single place with responsibility for it. And so I think one idea that is being proposed is to have a minister for children, to have that kind of portfolio that has the direct responsibility and the capacity to bring other portfolios in alongside it, that has budget and that has that capacity to take on this challenge. I think without that, it's going to be a struggle, but I'd be interested in other people's views.
Thanks, Ben. And I'd like to get in trouble again by doing a long introduction for Fiona, because and also note that there's been a question in the Q&A around the prevalence and issues for Aboriginal or First Nations communities. But I would just like to introduce Fiona Cornforth, who is the CEO at the Healing Foundation. She has a Wafapi and Zenard his family roots from the Torres Strait. She's the CEO of the Healing Foundation, which is the Aboriginal and Torres Strait Islander national organisation leading the movement on survivor-led intergenerational healing. Fiona's gained experience and perspectives in education, leadership and business development globally, and she shares a message of celebration and gratitude for the greatness of ancestors, elders and the ontology and authority that holds her and her family. She is a board member of the National Centre for Action on Child Sexual Abuse, and I'd like to invite you, Fiona, to respond to some of the things that you've heard in this data and the question around this that's come from the audience about prevalence in Aboriginal and Torres Strait Islander communities.
Yeah, hello everyone. I want to acknowledge that I'm on the lands of the Yagara and Turrbal people here today, me and Jen. Thank you, everyone. I guess starting with my big takeaway, just to add to the others, is that for me, there's a lot to take away, but the large extent that child maltreatment contributes to our national crisis in youth self-harm and suicide attempts, that's no longer deniable. It's the service system, as you've mentioned, it does need to support victim survivors better, and it has to be scaled up urgently, and at the same time that governments invest more in prevention. I couldn't help but think of the Bringing Them Home report. It still is a gift to this nation from the most courageous of us. who were maltreated systematically. And those warriors, they forewarned in that inquiry through their voices, brave voices, that the effects of maltreatment for health and preventable and premature deaths and dying. Back then, 26 years ago in May it'll be, and not enough was done. And I guess it just underlines to me why we're here, why we're doing this, and why I'm a part of this, why the Healing Foundation is a part of this, because we must take these learnings and thread them through everything we do to address once and for all the healing needs, plus make inroads for prevention. We have the privilege and the honour of being survivor-led, and it's just consistent justice seeking for families, for individuals, for victim survivors, and safeguarding children has always been at the centre. That's what I want to start by saying when we talk about the prevalence for Aboriginal and Torres Strait Islander young people and children. I want to commend the work in particular of the national leader, Snake, the voice of Aboriginal and Torres Strait Islander children, in calling for urgent action and highlighting the crisis. And to undertake that staunch truth-telling and correcting some of the false narratives and highlighting alongside many of us as community-controlled organisations working directly with those suffering the most. There's not a lot has happened, as I said, within those 26 years and since bringing them home. But now we can't just do things incrementally. We've got to take giant leaps on this stuff. And it is about honouring once and for all the experience of survivors. And just grateful to be on the board and with you both, Jo and Cathy, and thank you for your comments as well. And thank you, Ben, and your team.
Thanks, Fiona. And Ben, I'm wondering if you would like to respond to that, and particularly about the next phases of the next waves of this study.
Sure, and thank you very much, Fiona, for your comments. I'm always struck by your comments each time I hear you speak, and I couldn't endorse more strongly the view that we absolutely must be led by the experience of those with lived experience, and that's what we're all about here. In relation to what looks like being planned for the future, what I can say, and this is on public record, is that the Australian government, through the National Office for Child Safety, has committed to support a second wave of the Australian Child Maltreatment Study. And the basic idea behind that is to conduct another similar general population study so that we can chart trends over time in child sexual abuse. So basically, the idea is to conduct another study with, most likely with another youth sample, so that we can see if that trend line in child sexual abuse in this instance is continuing to decrease slightly. And if it is, to identify the areas or the classes of offending where it is continuing to decline, but equally to identify any hotspots of concern or areas where we need to pay even more attention. Alongside that, there's some current work being done by me and my team to explore methodologies for projects within a Wave 2 study, separate dedicated projects about the particular experiences of special subsets of the population. So, for example, Australians with disabilities, Australians from culturally and linguistically diverse groups, and First Nations Australians. And so there's some work being done there, technical work about, optimal methodologies, but also some testing. I'll just point out that the first, and sorry if I didn't make this clear at the outset, but this first benchmark Australian Child Maltreatment Study was designed as a general population survey. So everyone in Australia, age 16 plus, was eligible to participate. We accessed participants through randomly dialed mobile phone numbers. Now, our sample was representative of the population, so across states and territories, by gender, by, say, metropolitan, regional, and rural location, for example. We did have, in case anyone's wondering, we had proportionate participation by Indigenous Australians. So we had about 3% of our sample who were Indigenous. I will say that we have not and will not analyse the data from Indigenous participants in our survey separately. And there's two main reasons for that. One, it would not be ethical to do so because the study was not designed for that purpose and as appropriate to that purpose. It also would not be methodologically sound because even though we had 3% participation, we've got still small numbers that aren't amenable to robust statistical analysis. Hence, that's the reason why one of the things being done at the moment is exploring the appropriate methodology for a study dedicated to the experience of Indigenous Australians, and whether that happens down the track, and if it happens, that's a separate issue and a decision for funding bodies. If it happened, it would likely be done by a separate dedicated team led by Indigenous Australians, and it could only happen with the consent and strong participation of communities, obviously. Yeah.
Right, thank you. Well, look, I see that there's some linking with your sort of strong call, Ben and Cathy and Joe, to government action, and Fiona, to government action around legislative options. For example, mandatory reporting around the emotional abuse, or indeed some comments around online environments and access that children have to certain apps and the online, which we know is a very concerning environment and a risk that we probably don't really understand as well as we would like. Joe, can I come back to you? What do you think are the government responses that we need to see, particularly around legislation?
I think the response that Ben's talked about, a Minister for Children, we've been calling for a Minister for Children for 20 years. There's been one in that time, Larry Anthony, and he was short-lived as a minister, and since then it disappeared. I would think that there is a need for some structure and structural change in government, as well as some legislative responses, but there's more that's going to be needed than those kind of responses. I think of it, if it's a crisis, if it's an emergency, you would have you would bring together the people who know this issue very well, and you would set up what was set up 30 years ago. And again, we haven't had one of these for a long time, and that's a National Child Protection Council. The last time Australia had one, I think, was in 1990, and it was set up then as a vehicle for bringing the kind of best minds together to look forward into the future and decide what are the strategies that we need to put in place now. Part of the problems I think that we're facing from a government perspective is that there are too many single issue frameworks that have been set up, of which the National Centre is one part of a child sexual abuse prevention strategy. But there's a You know, there's a family violence one, there's one around protecting Australia's children, there's a mental health one, there'll be a child care, an early childhood one soon. This issue cuts across all of those, as Ben and others have said. So I think that we need a structure that's going to be long-term and impervious to the influences of what government is in, that stands above it all and is able to help shape the strategies that are going to make a difference to this particular problem that we're facing. And it's not just one problem. Ben's only talked about child sexual abuse today, but he's got data on 4 other forms of maltreatment, and he also hasn't told us, which he has in all of his reports, that there's a lot of people and a lot of children who suffer more than one type of maltreatment in their life, and that compounding effect is you know, the compounding effect of multiple types of trauma is disastrous for the life course of individuals. So I think that's probably where I would start. I don't think it's enough to have just a Minister for Children. I think we have to go further than that. And I think that we need, for example, we need nationally consistent data. We don't even have that. Ben in the research has for the first time come out and shown us how widespread this is. This is not a problem that only sits in Victoria or only sits in the NT or is for a particular subtype of the population. This is across the country, and yet we run child protection systems as if there are 8 different types of communities out there, and with different legislations, different thresholds, and all in all, most of the time, children are being re-referred and re-reported multiple times before they get an intervention. That's quite clear from all of the data. So even basic things that we need haven't been put in place to be able to address a public health problem like this. And this prevalence data gives us a good start, but there's so much more that needs to happen. I'll stop there. Yeah.
I think one of the things that people might be aware of is that the National Centre is in a position both to look at and respond to the issue around protecting children, as well as to respond to the really important issue, which is this longer term experience for adult survivors, victims and survivors, as they access support and care. So there's a response around children, and then there's, as Fiona spoke about, listening to the voices of people who are living with the impact of child sexual abuse and other forms of child abuse, and learning from them about how the system could respond better. And it's not as easy, it should be as easy, but it's not as easy as teaching our new workers coming through the system to do more than ask what's wrong with you. People need to be asking what happened to you, and using that to understand the way that people are presenting. I might go to Cathy or Fiona, whichever of you would like to respond about, you know, the additional piece, which is working in the child protection space, but also working in the adult space. Cathy, you're on mute, so you'll need to unmute. Yes.
Someone had to do it, and unfortunately it was me. I mean, it's hard. It's really hard to know where to start because, you know, we had a Royal Commission into institution responses to child sexual abuse. And what that Royal Commission did was start a public conversation about a topic that had been buried in secret and steeped in shame and stigma for way too long. And we saw many survivors come forward and, you know, tell their story. And I think for the first time, some of the community became aware of just what it means to have experienced child sexual abuse. It's not something that happened in the past, and it's done, and you get over it and just move on. But it lives and breathes with you throughout life. And so, but what was interesting about the commission, and I had some engagement with the media during the commission, and towards the end of it, the media would say, do you have another angle? Is there something, a bit more interesting? Because people were already becoming inured to it. So how do we, as a society, stay engaged with this issue? And we've seen it in the family violence space, where there are big inroads being made there, and we don't want this to be a competition. It's not about whose trauma is more significant, but just to understand that the needs of adults who've experienced this often repeated, often ongoing, often extreme, developmental, complex trauma related to child sexual abuse and other violations need ongoing support at different times in their lives. And this was a recommendation out of that Royal Commission, that survivors should be able to dip in and out of whatever services they need when they need them, for as long as they need them, because we know that it takes a long, long time for people to disclose. Often people will have tried to put their toes in the water as a child and been dismissed or not being believed or being punished for trying to speak out. And so it's very, very hard for survivors to reach out and seek help, because when you've been in danger and violated in that way, you don't feel safe. Some survivors have never felt safe. And so it takes a long time to build trust. And the service system at a fundamental level needs to understand that and work in a different way that actually takes into account the sensitivities and vulnerabilities of people who've experienced such trauma, the trauma of child sexual abuse and other violations. And I don't want to hog all the time, so I'll hand over to Fee.
Fee, do you have ideas about how we can do that? How we can change the system or respond in that?
Yeah, I think from the Healing Foundation's perspective, just working alongside workforces, whole of jurisdiction sectors in some projects, we know governments and their systems that have to do more than just resource properly. They've got to make every interaction between a survivor, and just building on what you're saying, Cathy, a healing experience, and at the very least to do no further harm in that interaction, and that just isn't happening right now. There isn't that compassion, there isn't that people usually aren't equipped, and our survivors have said this, and the leadership at the centre know this, but it's we want you to be trauma aware but healing informed. So do no more harm to us, understand what we've already been through, and know how to contribute to healing in your work every day, to the healing of survivors. And coordination across the services and the sector, but coordination on what healing contributions look like too, every day, and in every job, in every team, in every service. I know it seems like a huge thing, but I do know it's possible. We're doing it system by system, sector by sector, workforce by workforce, but we just need to scale up. We're doing it on the same money that we were given in 2009. We've got to do better with more resources.
Thanks, Steve. I'm going to ask Ben to tell the National Centre leadership, which is the board here and me, what you think the National Centre should be doing. What's your challenge to us as this new centre in Australia?
I hadn't expected that question, Leanne, but I'll do my best. I think I'm a cautious optimist generally. Obviously, there's a lot of really sobering, chilling news that's come from this study. I do cling on to some of the good news stories. And apart from the good news stories from the data, some other good news stories from things that have happened generally in Australia that haven't happened in other countries are the creation of agencies such as the National Office for Child Safety, the creation of a centre just like yours, the creation of other agencies like the Office of the E-Safety Commission. When I talk with colleagues overseas about these types of developments and about our Royal Commission, they are in awe of some of the developments that are happening here. So there have been some good initiatives and good developments and some world-class work. Our Royal Commission was simply peerless, and it has influenced massive change. Similarly, other agencies, including hopefully yourself, can influence massive ongoing change, not just short-term, but medium and long-term. And I think one thing that you may be able to do is you have this platform, you have this legitimacy and credibility, especially by bringing your agencies together that are all represented here today. And what I would love to see is sustained advocacy from your centre, perhaps mobilised together with some other key agencies to the Australian government. I know I keep harping on this, but it's because I think it's so important for some of the larger structural changes that we need, the larger structural and governance and funding changes that we need. Because a lot of individuals can make submissions, they can even band together and make submissions, but I think agencies such as yourselves just have that gravitas, that legitimacy, and that experience and knowledge and that massive capacity that you have. And so that would be one thing I would strongly support.
Joe.
Of course, Ben. It's part of our DNA, isn't it? It's part of the fabric about how the National Centre came about, was to help be a representation, at least one representation of the voices of victims and survivors to government, but also to take that knowledge base and that unique experience and the insights that come from that, as well as our own practice experience and the research knowledge that's emerging more and more, the knowledge that First Nations people give us about ourselves as a community, and add it into something that's going to make a difference. We can't look back in 10 years' time, have your next set of results come out and tell us that we're exactly in the same position as we were today. We can't do that. I don't know how to live in a community that will not take this on and make the changes that we need. And that's what the National Centre is all about. For us, it's really about making that kind of real sustained generational change, that in 10 or 20 years' time, we can look back and say, there are some real differences in the way that medical services, health services respond to the needs of victims and survivors of child sexual abuse, that there is a prevention framework, that there's a theory of change that is coherent and everyone is signed up to, that will make a difference in reducing the numbers of children that are sexually abused, amongst a whole range of other challenges. So I think you're right. I think that's what the National Centre is here for. And I hope that what we can do is galvanise, people who are interested in this area, who work in this area, who are survivors themselves, to come along with us and work alongside you as well, to make this information become more readily available. My biggest concern echoes what Cathy said, and that is that even in a month's time, all of the data that you've presented will have been forgotten. Because we know, even our research tells us that people don't tend to forget the topics that are really, really confronting to them. And this is a confronting piece of information that you've given to the Australian community. I don't think many people will want to believe the true extent of it. And I think most people will try to bury it in their consciousness because it's too painful to believe that there are people that we all know that have experienced child sexual abuse, and that it's in our families and in our communities. So I'm assuming we're getting pretty close to the end, Leanne.
To check whether Cathy or Fiona wanted to have a comment on the National Centre's role going forward.
Yeah, I mean, just to say that, Ben, thank you for giving us the tools to enhance our work and to help drive it home, because as you can see, we're all passionate. We come from passionate organisations that have been working in this space for a long time, and we're not willing to not see things change. We're not willing to keep doing things the same way because that's just the way we've always done them. This is about, using your evidence, obviously embracing not just the voices, but the expertise of lived and living experience and all forms of knowledge, and driving them home, because we can't see these stats in 5 years' time, in 10 years' time. We just won't tolerate it.
Thank you, Cathy. And Fee, did you have something that you wanted to round out?
Just echoing that in a way, because I come from a seafaring people, and what you say, Cathy, is correct. Like, we've got anchors now to keep us steady as we navigate this journey, but we also are so very aware of the urgency, and so we're paddling fast.
Indeed. Thank you. While Anna puts up a last slide that I just would like people to see before you disappear, I just really would like to thank Professor Ben Mathews and also Jo, Cathy and Fiona from the board of the National Centre for that conversation. And I'd especially like to thank people for your input and your advice, your questions and your thoughts, because we will take those all on board. And as we synthesize our direction forward, we have some further conversations coming up, and the next one will be with Detective Inspector John Rouse, who was the Australian of the Year in 2019, and the Associate Professor Dr. Michael Salter from the University of New South Wales. And we'll be talking about the online risks for children in technology. We also have some further conversations coming later in this next couple of months. A conversation between Cathy and Paul Klotz, a victim survivor, to think about complex trauma in the context of child sexual abuse. A conversation between Jo and Professor Paul Gilbert in the UK about the role of compassion in this work, and a conversation with Fiona, Professor Milroy and Graham G about how to create and restore safety for First Nations communities. And we would be very keen to hear your feedback and have your advice. We will send you a survey. You can expect to hear from us soon, because we'd like to make these in conversation pieces as accessible and as useful to you as possible. So we'll leave it there. Thank you so much again to this enormously brilliant panel. And thank you for joining us today.